Well, joining us now for today's Medical Matters discussion is Dr. Robert Harris. He's with Southest Urogynecology here in Jackson, and he's here to talk with us about a therapy for women called Mona Lisa Touch. Thank you so much for being with us, Dr. Harris.
Thank you.
Now, what is Mona Lisa Touch?
So Mona Lisa Touch is a CO2 laser, much like lasers used for face ablation and rejuvenation. There's just a new probe design now for use inside the vagina to rejuvenate and revitalize the tissues of the vagina.
Now, why would a woman need this procedure?
Well, estrogen is kind of the mainstay of women, and so as you lose estrogen, the tissues that are responsive to estrogen, one of which is the vagina itself, tend to shrink and shrivel or atrophy. And as those atrophy, then you get other symptoms associated with that.
Now, tell us how the Mona Lisa Touch actually works once you start doing this procedure. You kind of described it, but how does it actually work to improve this condition?
So a problem a lot of women have is moisture in the vagina, and dryness is a problem with subsequent pain or with intimacy. When you use laser energy, you stimulate collagen from deep in the tissue, and then it allows new growth of collagen out. With that, you get proteoglycans and things called fibrinocytes and such, and those produce more water and then form a new collagen layer that holds the water in place. So you really get thicker, more fluffy, more moisturized skin.
Now, this is not just an issue for menopausal women. We've talked about women who have breast cancer, and that could be women as early, right now we're seeing a big group 20 to 40 years old.
That's right, and that's really a huge issue for people 20 to 30 years old. You know, as we age, clearly intercourse becomes something that changes over time, but in the younger patients, it's a really big deal. And they cannot use estrogen, which is really the mainstay of therapy for this. So this is kind of a novel new approach, and especially it's relevant for those patients.
Let's talk about the indications or some of the symptoms that a woman might have to lead her to go and get help.
So the biggest symptom we see is that women come in and say, I just have so much dryness. And with that, you get irritation with intimacy. And then, you know, your bladder and your rectum are all kind of associated with the vagina. So urgency to void, frequency, looseness, not feeling enough sensation. So all of this really revitalizes the skin of the vagina.
Now, is this procedure actually available now? If a woman needs it, can she get it now?
She can. We actually bought the first one from Mississippi several months ago, and we've done several patients, and it's pretty incredible for most patients.
Well, obviously, the clinical trials have been very promising and have shown a lot of success. Can you tell me about the success rate? And apparently, it works very well for women.
Very much so. It was really introduced in Italy in '08. So it's been there for a while, and there's some 18-month follow-up there. Recently in the United States, Mickey Karam in Cincinnati and Sokol and Stanford did a kind of a pilot study with 30 patients. All patients had improvement. Many had complete resolution of symptoms. And what's been impressive for us is, in my clinical experience, it's just almost an immediate change. So patients are encouraged a lot after that initial treatment.
Now, when we think about procedures like this, we also have to think about cost. Is this considered cosmetic, a quality of life issue, or is it something that insurance will cover?
Currently, there is no code for insurance to cover it. So it is a cash procedure. But it's 3 treatments over a 12-week period, so a treatment 6 weeks later and 6 weeks later. We charge what I think is a modest amount, and our patients no one's really complained. It's been a real positive experience for our practice.
Now, when you think about the downtime, you said 3 different procedures, so is there any downtime at all, or can you have the procedure, go back to work, or just pick up with your regular routine?
Yeah, there's none. There's no anesthesia. It's a probe that goes inside. We have to turn it around several times and move it out, so I try to get most of the skin of the vagina, but it's just painless. It's, you know, come in, get it, and you have to put on some real funky looking glasses to protect your eyes from laser energy, but we haven't had any patients with any complaints.
Well, October is Breast Cancer Awareness Month, and we talked a little bit about that age group, 20 to 30 years old. Is this safe for them, or is this safer because obviously if you're being treated for breast cancer, estrogen could be a problem?
Estrogen is almost always an issue with breast cancer patients, and even if their oncologist told them it might be safe to use even some estrogen in the vagina, most breast cancer patients will just say no to that. And especially in younger breast cancer patients, the skin is just better. You know, everybody knows your face, your arms, everything. But for women in 30 years old, this works even better because you're revitalizing skin that was really a positive tissue to start with. So it's very much indicated for breast cancer patients.
Now, this is an issue that women don't like to talk about. They're uncomfortable talking
Right.
with their doctors about this, but it can be extremely painful, and can that lead to other problems if you don't get help?
Well, from a relationship standpoint, it's what we see. And even if it's not a relationship standpoint, I mean, when you're in love, you want to be intimate with your partner, and that's what we hear all the time. It's
Right.
not really that my husband's upset with me or is going to leave me. I just want us to be close, and that's really what most of the patients kind of talk about with us.
Well, this is really interesting, and I'm so glad that you came to share it with us today. Again, we've been talking with Dr. Robert Harris, and he's with Southeast Urogynecology here in Jackson. Thank you so much.